Hello, everybody, and welcome back to our How To Corner. In today's episode, we're going to talk about the 5 steps after shoulder surgery. I'm Will Gray III, your friendly neighborhood physical therapist. Before we get started, please like, share, subscribe, follow, comment. Let us know what you think about the content. If you have any questions, please leave your questions in the comments, and we'll be definitely glad to discuss them. With that being said, let's get going. Today, this is our agenda for today. We're going to have 5 talking points today. First, we're going to talk about the immediate post-operative care after your shoulder surgery, follow-up appointments. We're going to talk about physical therapy, activity restrictions, as well as long-term rehabilitation and strength building. Now, let's talk about the very most important part, in my opinion, is the immediate post-operative care. There's a lot of things that have to happen here, but we try to make it really short and sweet here. First and foremost, you want to make sure you rest and keep the shoulder immobilized and using your sling or brace as directed. For the most part, it's going to be about approximately 6 weeks. You want to make sure that sling and everything is put on properly. They don't always put it on properly after surgery. Just what happens, they don't really have the right angle. So if you're aching and it's not holding you and cupping you comfortably, then you probably need to get readjusted. You want to make sure you manage your pain with your prescribed medications as needed. Please do not abuse these. These medications only work up to a certain extent. They stop actually working properly after a certain time because of your body recognizes the medication, and pain is an alarm for you. So you really probably want to dive into the ice therapy. Ice is key. It works so well. If you are able to keep that area as cool as possible, it's going to really help with your pain, disrupt that signal, but also keep the swelling down, which is a key cause of pain. Keep the surgical area clean and dry to prevent infections. Do not shower. I repeat, do not shower. You do not want this area to become infected or those portal sites to become infected with anything at all. Don't shower, don't shower, don't shower. Use different cleaning agents around those portal sites to keep everything clean. And once you get to a point where you get released for showering, or you just have to shower because something really happened, you may want to get what we call a semi-permeable dressing, or a dressing that is waterproof, in order for you to be able to get in the shower. But if you can avoid showering for the first 2 to 3 weeks, that'd be perfect, because that particular area should heal up in about 14 to 21 days. When I say heal, I mean the portal sites heal, not your shoulder surgery area. Now, follow-up appointments. Attend all your scheduled visits with your orthopedic surgeon. You usually have a follow-up appointment probably 3 to 4 weeks after the first day of surgery. So please make that appointment. That appointment usually gives you your order to start therapy. A lot of people like to start therapy 3 weeks, or a lot of surgeons want people to start therapy 3 weeks after surgery. And then we'll proceed from there. Stitches and staples may be removed, and progress will be assessed. So at that particular point in time, if there are any stitches in the actual portal sites need to remove, they may remove those. A lot of people are not doing those type of actual stitches anymore. But there are some in there where we get removed. Staples are usually used during knee replacements more than anything. I haven't seen too many stapled up shoulders. And then at that time, your progress will be assessed. Meaning just looking at the actual surgical area, make sure it's not red and flushed or infected or warm. Just making sure that everything looks good and there's not any damage to the surgically repaired shoulder. And the doctor will remove restrictions over time. Key. Over time, you will get restrictions removed. Now, after your 3 weeks follow up, what you normally happens, you have physical therapy that's scheduled. Yes, you start at 3 weeks. And then during that particular first day, your surgery that you've had determines the protocol that is taken when it comes to your recovery. Now, in a perfect world, your surgical notes will meet you at the clinic, so the therapist has already went over the surgical notes. But let's just say that the majority of therapists do not do this. They do not ask for the surgical notes. They don't understand what they're reading, and it's really not a good thing, because what you find out is that there's a lot more happens in the surgery than the order actually states when it gives you the therapist as well as you your diagnosis. So if you have a slap lesion and you have a type 1 rotator cuff repair, the slap lesion, in addition to that rotator cuff repair, you're going to have that slap lesion that's going to take basically front street, and it's going to be the thing that's going to just decide when range happens, how aggressive a person can be with your shoulder in recovery. And then from there, you make a plan, and that plan is marked with milestones. Now, recovery ranges from 4 to 6 months, depending on the prior function. If you're a person that's returning to a job that you have to lift things over your head that are above 10 pounds, you're probably going to need 6 months up to maybe 7, 8 months, depending on what you're lifting. If you're a person that goes back to your regular life, you'll probably be out and be able to do what you need to do in about 4 to 5 months. But you still have some weakness there. So don't fall into this lull of like, I finished therapy, now I'm good. You may need a little bit more strength. And if you do, then okay, just stay for your 6 months. But if you don't, you feel good, you can wave your hand at people and put your bra on if you're a lady and be able to pick up stuff that you want to pick up and handle it with pretty much pretty ease. And then guess what? That's what you need to do. That's great. And then you're good to go. But if you're a baseball player or overhead athlete of any kind that throws a ball or use their shoulder, you're going to need probably about 8 to 12 months just because of what it requires. You will realize that even when you return to the sport after 6 months, there's still some strengthening that has to occur to make sure it's ready to rock and roll. Now, physical therapy is really critical to regaining mobility, strength, and function. A lot of people do not understand that there's levels to doing therapy. There is legit levels. Not everybody is created the same when it comes to world of rehab, as well as the patients are not created the same. So you got to find a therapist that's actually versed in this. And it's not just the therapist that people say. Sometimes it's therapists that people are not aware of in your area that you may need to reach out and ask people who've had an injury. Hey man, who helped you with your shoulder? I said you're back to throwing this baseball 100 miles per hour. Or who helped you with your shoulder? You're back to playing quarterback. You have any issues? Like nope, and they'll tell you it is. So you can use different routes to figure it out. And when you find that therapist, make sure you get in lock and step with them, and you all communicate a plan and try to get to the goals or the milestones that are set. Now, your activity restrictions. Your activity restrictions from surgery until you're done and go kind of like this. Usually you're sleeping semi-supine or in a recliner for approximately about 6 weeks. It says wedges there. Yeah, typo. Please do not go to the doctor office with this and say, hey, my therapist, Will Gray, said wedges. No, we are wedges. We're going to say 6 weeks. Early on, do not lift arm above shoulder level during the early healing phases. As you reach certain milestones, your restrictions will be adjusted. Simple. As your range of motion get to certain places, as your strength improves, you better actually do a lot more. But do not be in a hurry to rush your recovery. Not really how it works. When it's time for you to go and your restrictions are time to be lifted, they will be. You'll be good to rock and roll, but don't be in a rush. Now, long-term rehabilitation and strength building. Continue exercises at home consistently. Like I said, depends on your prior level of function. Focus on rebuilding shoulder stability and strength. That's super, super important. Just because you got out therapy, like I said, doesn't mean that you're all the way done, meaning that you may need some more strengthening. And then full recovery may take several months depending on type of surgery, rotator cuff labor repair, and so on. If that's the case and you feel like you're going a little bit slower, just make sure your range is being achieved. Your range is super important. As you're able to achieve your range, then guess what? You're able to get your strength later. That range of motion is super important. That really tells you if you've been doing what you need to do. Your strength may come a little later, just depending on the severity of the surgery, and that's okay. Now, I want to thank everybody for listening who made it to this particular point in the talk. We really appreciate everybody who actually presses play and listen to what we put together. We just try to inform all of our clients or clients that are maybe future clients, and anybody who's wanting to learn more stuff of what to do, what to expect during your actual procedures. And if you're looking for us, you can find us on all platforms. Instagram, Facebook, TikTok, and as well as YouTube. In addition to that, if you have any questions, you can go to our website and go to our contact page and send us an actual question through our contact page, and we'd be glad to respond to you and try to help you out. With that being said, if you have any questions or you have any issues or concerns, please reach out. And we hope you have a blessed one. We'll catch you in the next one.